But right away, just to give an introduction to myself, I'm actually a total GCU student. I got my bachelor's in psychology in psychology from GCU, no minors, no emphases or anything. I lived in Ironwood Hall when I was a freshman. So, and then I started commuting, and then I did, I believe, like my very last semester once I started working, I took online classes. So I've actually done all the different modalities. I got my MS in health psychology from here at GCU. That was an online degree. And then just about a year away, just under a year away from graduating with my doctorate, my PhD from GCU as well, which is a hybrid, like a set of courses which are online, and then you can go in person for residencies and you present your research. It's a non-clinical, non-APA accredited doctorate. We're going to talk a little bit about like what the different doctorates are, what that means. But yeah, so we're going to go through student worker jobs here on campus. I'm going to do a little poll when I believe in a couple of slides here, just to get a gauge for what years you guys are in, and you know what kind of intentions you have when you graduate, just so I can get a good idea of what you guys are looking for, so that when I go through the little presentation, I can make sure you get what you need. But feel free to ask questions as they come up. And then we're going to talk about grad school. I talk about grad school at GCU, but there are a lot of different elements that can apply to other graduate schools, and I'll tell you about them. And then a little bit about the class that I teach, that I have expertise in, which is health psychology, just a little intro to health psychology and what it would take to get into health psychology, education-wise, experience-wise, things like that. So let's kick it off first with student worker jobs. I'm sure a lot of you raise your hand if you're a student worker already, so okay. This isn't going to help those people because they've already got a student worker job. There is a difference between GCU jobs and GCE jobs. So a lot of people don't know that when they're searching for student worker jobs, and they kind of just look up GCU student worker jobs. They go right to the GCU website and they say there's nothing available. And it's like, well, there's a whole set of jobs at GCE, which is Grand Canyon Education. Years ago, we split, and Grand Canyon University is the university. It's where the faculty work for the university, the colleges, and then GCE is more like the operations, the logistics. So your SSC works for GCE. Any of the student workers who work for the SSCs in ground operations or in the ART for giving tours and stuff, they work for GCE as well. It's that company that kind of provides that. So you'll find that those jobs are actually really cool because you get to work in like an office setting instead of working as like a cashier, for instance. Most of the GCU jobs are a little more oriented towards the food services and more of those hands-on positions, whereas the GCE jobs are going to be more office positions. Great for a resume. I was in ground operations when I was a student worker for undergrad kind of thing. And so some of the jobs will be federal work study eligible or not federal work study eligible. You'll know if you're federal work study eligible. And that basically means that you need to work to pay off for your school. Like it's part of a federal program that you are basically required to have a job. And so some jobs will say that they're only federal work study eligible, meaning if you apply, you have to be on that program to get in. So it basically forces it so that people who really need a job can get a job. And mostly the GCU positions are listed under that FWS status. And so it means a lot of people can't apply to them. And so that's another reason why you should check out both if you're interested in a student worker job, especially if you're a freshman, sophomore, and you've got still some time and you want to build some cash and work flexible hours that work with your schedule. One of the rules we have at GCU is if you're a student worker, student comes before worker. You have class, you have academics to worry about before you're an employee, before you complete your job operations and things like that. So that's just a little thing on that. Most of you probably know how that works, but let's do a quick poll. If you guys bring out your cell phones, you should be able to scan a QR code. This is the first time I'm going to be using this, so let's see how well it actually works. I have no idea. First question is, what year are you? Oh, it's kind of covering the thing there. And then just keep it on your phone, because then when I switch slides, it'll take you to the next one. Just make sure you absolutely click the right one. You guys in the way back, it's going to be hard to get that QR code. Just make sure that you are sure what your answer is before you hit submit, because you can't redo it, I believe. But okay, just do it based on credits. Even if you've only been here for a year, but you're at the sophomore level, that's fine, right? Okay, pretty cool. So that means for a good portion of you in that first two, the year one, year two, freshmen, sophomores, you guys have a lot of options, which is really cool. In undergrad, you get a lot of elective space. You get a lot of options for like the jobs that you can take because you've usually got a little bit more time here at the university than our juniors and seniors who are ready to kind of head out. And so it's a little harder for them to take advantage of opportunities like different classes or things like that because their schedule's full, right? So really value this information, freshmen and sophomores. This is really important because you want to set up your schedule, you want to set up your employment opportunities, everything to really work out in your favor for when you're going for graduate school and things like that. I don't know if this clicker will, oh, it totally does. Okay, so I want you guys to answer this one. Are you considering graduate school, master's, or doctorate level schooling? I'm curious if we'll get any no's. And, wow, okay. Yep, that is, so that's usually a good thing if you're considering graduate school in psychology. So I don't have this on the poll, but raise your hand if you're a psychology major, like if that's totally your major. Yeah, okay, just double checking. Not everybody, you didn't raise your hand. What's your major? Bio. Bio? Okay. Any minor in psychology or? Yeah, okay, perfect. Pre-med, pre-pharmacy, what's the? Pre-med, okay. Fantastic. I get a lot of those students in my health psychology class. It used to be required for the nursing students and the bio students, pre-physical therapy, pre-pharmacy, pre-med, all that stuff. But okay, so that's good. That means a lot of this information will be helpful because we're gonna learn quite a bit about graduate school here. And then the last one, what is your end goal job, like dream job after all your schooling is completed? Type it out, type something nice, don't like swear. It's not a real class, so I'm not gonna really care, but that's not cool. Lawyer, okay. Therapist. Child something, child therapist, I'm hoping. Interesting. Criminal profiler, forensic psychology, okay. Professor, nice, I like that one. Okay, yeah, and you can put, it looks like you could put a few. FBI agent, okay. Wow, I have never done this before, this is cool, I like that. Okay, working with teens, working with children is really common too. Okay. Has everybody answered? Did they get their chance to put their stuff in? That's, yeah, I've never done that before. I really like that. So, okay, that's public schools. So school psychologist, maybe?
Yeah, I wonder who's lawyer and who's equine.
I like that. That's crazy. It's super cool. Okay, so that gives me a good idea then of if you guys want to, if the officers of this club want a screenshot of that.
Honestly?
It's kind of cool, right?
Honestly, that's insane. That's pretty cool. Thanks. Yeah. Thank you.
Just gonna save this, hang on. Gotta get that content, right?
Yeah.
My full-time job outside of all this is I'm a marketing manager, so I don't like marketing very much. I much prefer psychology. It is kind of nice to have a full-time job that you can save money with. But okay, let's talk a little bit about graduate school, some of the different options within that. Now that I have a good snapshot, it sounds like a lot of you are in that clinical focus. I didn't see researcher up there, which is totally fine. We're going to talk a lot about graduate school. To start off, this is GCU's graduate school, and this is our master's programs. Typically, you take it online, and on the left there, it talks about the online modality. So there's no lectures in online. It's very much like an undergraduate online class. You have to do DQs, and you have to do responses. But it's only 3 responses on 3 separate days instead of 6 responses split up on 3 days, which is actually super nice. Problem is, for a graduate program at GCU, you have to do reference lists and citations for every response, post, everything, every single time, or else you lose points, right? And so I've been doing that for like 6 years straight, and it's a lot of DQ posts. So assignments are also due on Wednesdays instead of on Sundays. So that means, I'm trying to think, correct me if I'm wrong, for undergraduate, if everything's due on a Sunday, what is that, Friday? No, it's not. Would it be Wednesday and Friday is when you have DQ1 on Wednesday, DQ2 on Friday, and then Sunday is the due date, is that correct? Okay, so in this, Saturday is DQ1, Monday is DQ2, and then Wednesday is your midnight, do it midnight assignments, meaning you don't have anything on Sunday, which is actually super cool. Most people in the graduate program are adults with families, and they leave their Sundays open, and it's actually kind of nice. The only thing is everything stacks up during the week, and that's for all of our graduate programs, by the way, is this online modality. You can do it on ground if the program has availability for on ground, if they have enough students, basically, and they will run the class starting about now, actually. This is when the the on-ground master's and doctorate classes, this is about when it starts, and you go for like 3 hours. And then you're done one time a week, 3 hours at night. And so I don't recommend that, especially if you work, because you're gonna be really tired. If you can make online happen, I personally think you should make online happen. Thing is, you don't have to do the DQs. You have a long lecture, and you do get a little bit more flexibility in that regard, but it's still that's kind of brutal. I would never do that. I taught a 5 p.m. class, and that was late enough for me. Like, this is late for me. This is too late to like be sitting down for a lecture and being there until 9 p.m. That's too much, right? So, but if that's something that you need, that's actually an option that you can have. I know the MBA program doesn't always have that, Master of Business, one second. But the MS in Psychology and the Master's in Clinical Mental Health Counseling sometimes has that ability. Start with you in the website, yes?
I wonder, is it just like one class or like one lecture for that week, or is it like multiple classes, but it just happens one like?
It's usually one Friday every week you show up to a lecture for your class. And you only really take one class at a time typically for the graduate programs here. You can take up to 2 at a time. I don't know how that works for the on-ground modality. Anytime I've heard that, it's usually 1 class at a time. So it's not perfect, it's pretty rough. It's night school, right? That's what it basically is. Yes?
Does GCU have a child life program masters?
We will talk about that. We do have specific programs that focus on that particular population, and in a few slides we'll talk about that. Not sure if it's exactly what you're looking for, but we'll go through that in a few seconds. Any other questions about kind of how that modality works, or anything kind of interesting? A lot of students going into it don't know that, and they're like kind of surprised by it. Yes, another question?
Can you do both, like online and some in person?
Not typically. If you were to take online classes and then say this is not for me, you can then switch to on ground, but we don't usually say let's take a few like classes that are on ground and a few that are online. Like, we don't usually do a mix. It's usually because you've taken online a few classes and you're like, this is not working, I need to switch to on ground. Yes, again?
The classes are 3 hours. Can you just take it more days a week and less hours?
Not typically. Again, the availability is pretty limited. Out of, I would say, of all the graduate students at GCU, I would say probably 93 to 95% of them are online. Meaning we don't have a lot of instructors who do the in-person, and it's not a very desirable class because it's late. When you're an instructor, you don't want to work late or really early, typically, because you want a normal work week, because you're already grading all weekend, kind of thing. Like, I left church on Sunday and I started grading and I had to get them published, and so you don't want to be also going to classes at 6 p.m. and so they don't usually. And it depends. I would say on average they're 3 hours long, but not guaranteed, and some are shorter, some are longer potentially. It really depends. It's graduate school, so it kind of is, fly by the seat of your pants in terms of how the instructor wants to do it. Yes?
Can I ask, is this like typical of all universities or just GCU?
So we'll kind of go through that. There's 2 classifications I would probably say for graduate schools. One is online, like GCU, and the other is brick and mortar. And so each of them are equally brutal. In terms of like, and that's not a joke, it's brutal. Graduate school is a lot of work. I was like, so I'm doing and now doctorate was a big difference from master's, I will say. But like for the last 5 or 6 days in a row, I've been up until 2 a.m. writing my manuscript, kind of thing. Like, I'm exhausted. Like, it's not easy. Like, you will probably do that. Like, it will probably happen. Not everybody graduates with a doctorate. Not everybody graduates with a master's. It's hard. And so, in honesty, that doesn't mean you can't do it, by the way. It means you can. It's just you have to be ready for it. You can't just go in saying, yeah, I'm just going to float through it and go partying every night like undergrad. Like, you actually do have to make a few choices that are usually, hopefully, oriented towards success and not, ignoring things. So first off, online usually means that you have more professors, you have more class space, and you have more seats. So in an online program like GCU, if you apply, your chances of getting in are really high. Like 50 to 75% of them get in, kind of high. If you go to a brick and mortar school with 100 seats, so I also teach at Carroll University in Wisconsin, we have 86 students in our master's program, and I'm capstone chair. And that means the last class before you graduate. And we have 86 students, and we'll get probably 2,000 to 3,000 applicants, that come through at any given time, because we can only accommodate that many. So that means our acceptance rate is very low, right? And so that's a brick and mortar school, whereas an online school, they'll accept you. The problem is they'll accept you even if you're not ready. And so you'll take class 1 and there'll be 30 students in your class, and then you'll take class 2 and there'll be 15 students in your class. Because 15 of them, half of them couldn't handle the pressure and the deadlines. And it's not a lot of pressure early on in a master's program. It's actually quite similar to undergrad. You just have to meet the deadline. So many people aren't ready for that they end up dropping out because they didn't submit their first assignment, kind of thing. And that's much like undergrad, by the way. If you took University of Success, you'll notice that not a lot of people actually graduate and complete University of Success. That's our highest failed class on campus. Do you know that? Do you know why it's our highest failed class on campus? Do you know why? It's because assignment number 1 is, here's 100, it's just a worksheet, and it's 100 items on that worksheet, right? And you have to go into the website and go to library links, whatever, and then post a link to prove you went there. That's all it is. There's nothing mentally challenging about that. Most people start at 11 p.m. Don't submit until Tuesday, because that takes time, right? It doesn't just happen instantly. I've done all that, it just takes forever. It's not hard, it just takes forever. That's the entire point of University Success, to teach you about the cadence of submitting assignments on time, and most people can't handle that. And that's honestly a good thing, because that means they're not ready and they shouldn't be paying for any more classes if they're not gonna be able to graduate. I'd rather them save their money, discipline up by working or whatever, and then come back and then absolutely nail their degree, because they've prepared for it, right? It's on you as the student to do well and to put in time and things like that. That's a good thing. And so graduate programs, you'll notice, Masters in Psychology at GCU, your first class is called University of Success for Graduate Studies. And it is precisely the same thing, same principle. Nothing difficult, just meet your deadlines. And if you can meet your deadlines and you can do that, you're gonna have no problem getting it. It's not about intelligence, it's about how well you can keep yourself disciplined. So it's not something you should be afraid of. It's actually a good thing. It just means you do have to make those choices, and I'm gonna put some work into it. And so brick and mortar usually means we don't accept many students unless they're the best of the best applicants. Online usually means that we accept a lot, but many of them will drop off by that first few classes because they're not truly ready and they can't handle the discipline. Both are brutal. That's why I say they're both brutal. Because one, almost no one gets in. The other one, almost everyone gets in, and then they drop out pretty quick afterwards. And that's kind of brutal, right? And so only the best move on. Only the best get in, or only the best move on. And so that's not a hard threshold to meet, though, I guarantee it. It's actually pretty straightforward. It doesn't take a whole lot of intelligence to do really well in graduate school. It just takes dedication and being okay with spending a few hours sitting down and writing a paper, honestly. That's kind of what it ends up being. So one of the things that I do in this presentation is I show you what questions they ask in the application process. It's actually super cool. They haven't changed them as of yet, or at least as far as I know yet. First of all, most master's programs, you'll write a letter of intent, and you'll say why, and the question is usually, okay, I want you to write and submit a letter of intent, and we're gonna read them and see if you can get accepted into our program, right? It's just the application process. Usually the letter of intent says, what do you intend to do after you graduate with your master's degree, or after you graduate with your doctorate degree, or whatever. That's usually the question. And so you write a letter about that, and then you submit it to them. Sometimes they ask you essay questions. For GCU's Masters in Counseling, these are the 2 questions they ask you. I just watered them down because they're kind of long. And first question is, what is your desired career path after earning a master's degree in clinical mental health counseling? Very similar to your letter of intent. The second question is, clearly explain how you would uphold the cultural diversity disposition as a professional counselor. That's a really common question for graduate schools. Almost every single one will ask you that. How do you uphold a strong cultural diversity disposition? This says it should be a cultural diversity disposition. Disposition meaning a quality as a student, typically. And so your answer can't be, I've experienced cultural diversity, so I'm gonna be really good at this. That's not usually how we like to see those applications filled. We usually like to see people say that I don't know every culture. That's usually what your answer should say. When you answer, how will you uphold diversity? You usually say, I don't know every culture. I don't know every religion. I can't possibly know every walk of life, but I'm really, really dedicated to learning it for the benefit of my future patients and clients. If in essence your answer says that, you'll get it. Very easily actually, because you'll stand out by it. to everyone else's responses. It's actually a really good way to do it. And so those are the two most common questions. GCU uses those two questions, at least they have. I'll have to double check with any new applicants and they'll have to let me know what the questions were, make sure that they haven't changed them yet. But those are pretty representative of what you would see in an application. In terms of that program, Master of Science in Clinical Mental Health Counseling, you can do no emphasis. You can do a childhood and adolescence disorder emphasis. You can do Christian counseling emphasis, marriage and family therapy emphasis, and a trauma emphasis. So that just means that a few of your extra classes are oriented towards those subjects. It's not like a whole different program. It's the same program, but you have a few extracurricular classes that orient towards that subject. It's really good. It's really cool. Getting a master's in clinical mental health counseling usually takes over 2 years compared to a normal master's degree, which is not clinically based, which can usually take 1 to 2 years, whereas this will probably take 2 to 4 years because it's clinically, it clinically leads to licensure in your state typically. So each state can set their own rules. If you want to practice as a therapist in Arizona, you would have to get a degree that leads to licensure in the state of Arizona, which GCU's program does. And all you got to do is Google that, and you can find out what schools lead to licensure in what states. But if you don't get one that aligns to your state, you might not be able to get licensed as therapist. You always have to double check before you start paying for classes in a program, right? So I know that GCU's program works for California, but you always have to call and make sure that that's true. Yes?
What do you recommend for someone who doesn't quite know what state they want to work in yet? Like if they're still trying to like look into that, do you have like a specific area or like place like state you recommend them going?
No recommendations for state. My answer to that question is okay, because I've had that before, where students come to me and say, I don't know what state I want to be in, what's your recommendation? My answer almost always is figure out what state you want to be in, first and foremost, because every state has their own rules. Meaning it's hard to just get a degree from somewhere and say, okay, wherever I end up, I just pray to God that it works, right? That's usually not the best way to go about it. I would typically recommend really try and figure that out while you're an undergrad or before you enroll in a master's program, and it'll usually help you figure that out. Some states have more comprehensive criteria for becoming a therapist in their state, and if you can find a state that has really high standards, then it means that you'll likely be applicable to other states. Doesn't mean it's guaranteed. If you're considering like 4 states, look at the websites for all 4 states and find out what differences there are. There also is a rule in many states where if you hold a license in one state, you can transfer it to another. But you have to look up those websites. And I'll tell you kind of what the websites are. First, in the very back, yes? Yes.
Would it be like a smart thing to go to a school for your master's in the state you want to work? Like if I want to work in Oklahoma, to go to a master's degree in Oklahoma because that school's more likely to give me the classes as I need?
I would say that's a good plan, yeah. You won't typically, so when you go to a website for a state, like if you go to the Arizona Department of Behavioral Health Examiners, which is the agency in Arizona that regulates whether you can become a therapist or not, whether you can get your LPC or not, that's everything, right? So if you go to that website, you'll notice that it lists all the degrees in the state of Arizona that lead to licensure in Arizona. It will never list a California school. It will never list a school in New Mexico, in Nevada. It won't do that. So the only way to guarantee 100%, other than calling AZ, Department of Behavioral Health Examiners, other than calling them and say, hey, I'm planning on getting a degree in California at this school, does it work? And then they look around and they say, yeah, I think so, you're good. That would be the only other way to guarantee it, is to go for a degree in the state that you want to practice in. That's typically, especially if you know for a fact, I'm gonna be in Oklahoma, then yeah, I would highly suggest looking at the schools in Oklahoma, finding one, make sure that it leads to licensure by looking at the Oklahoma State Board of Behavioral Health Examiners, whatever they call it, and just double check. Again, because it's expensive, yes.
Some schools can't be licensed. Like if I go to a certain school and it's not licensed, what do I do?
Depends on the program. And you probably wouldn't have enrolled in that program if it wasn't leading to licensure, in all honesty. It doesn't influence you at all at the bachelor's level. State recommendations for master's programs won't influence you, and AP accreditation doesn't apply for undergraduate or master's, and that's different from counseling. So in your case, you probably won't come across, if you come across a school that says master's in like childhood counseling, for instance, and you look at the website for that state and it's not listed as leading licensure, you shouldn't go to that school expecting to become a licensed therapist. You need to make sure that those align. So you would do that before you apply and start paying for your classes anyway, so I'm pretty sure that wouldn't happen. I mean, it has, but that's usually because the student said, oh, I didn't look at it until halfway through the program. And it's like, well, that was the wrong time to start researching, right? Research prior to enrollment. Was there another hand up? Yes.
Do you know anything about the Interstate Counseling Compact?
Yeah, so they're working on that. So what it is it's basically a set of laws where states agree to have the same standards, which is pretty radical, right? To be like, yeah, each state has the same standards. Now, they haven't currently activated those set of laws yet, and I wouldn't bank on them saying, yeah, I'm gonna go to a school in the middle of nowhere and just pray that they're part of the compact or that they're part of this set of laws. They're not there yet. So don't expect things to change in your favor. Always try and operate within how it exists now. But they're trying to basically get it so that states get on board for it and say, yeah, we all agree that we're gonna have the same standards. So if you get a degree from any program that leads to licensure in any of those states, you're set. And so they're working on it. It will be awesome, but not yet. In California, might not be part of that, I would say. They have a higher set of standards rules, and that's not a bad thing. Honestly, you want your counselors to know what they're doing before they start talking to patients. 100%, I don't want a counselor that doesn't know what they're doing, right? And so that's why we have regulations, to make sure that your training is adequate before you start messing with someone with suicidal thoughts or severe depression. You can't be messing with someone unless it's just like surgery. You don't want them it to be your first time, their first time doing surgery. You're like, we'll give it a shot. Like, no, don't want that. I don't want that from the heart surgeon, right? And same with your counselor, you wouldn't want that either. And so they're working on that though. That's really cool because my IA Asa, he's getting his master's in clinical mental health counseling from here at GCU, and he was telling me about those laws the other day in class, and I was like, that's super cool. He was also my best man at my wedding. I love Asa. Super nice. But yeah, he was telling me quite a bit about that. Okay, so Master of Science in Psychology. This is different from counseling. If you get a Master of Science in Psychology, from most schools, it will not lead to licensure in your state, typically. Now, the program that I teach for in Wisconsin, which is at Carroll University, is a Master's in Behavioral Health Psychology. So that's actually an example of that leading to licensure. It leads to licensure in the state of Wisconsin. So that's why you always do your research on programs that lead to licensure. In most cases though, when you go for a psychology master's degree, including at GCU, it doesn't usually let you clinically treat patients, not usually. Again, you always have to check that program. If it doesn't have internship hours though, you can pretty much guarantee that it will not lead to licensure in your state. You need to have hands-on hours in front of patients. And so school psychology programs will have that, things like that. At GCU, you can get your master's degree in psychology focusing on general psychology, forensic, health psychology, neuropsychology, which is adults and aging, and then human factors and industrial and organizational psychology. Those are kind of our track options. This is a relatively quick degree, I will say. 1.5 years is average. I would say 1 year is fast. That would probably be the speed that you can get a master's in psychology, and it's not overly unfairly difficult. There's nothing about it that's unfair. I did that program. Nothing about it is unfair. It's actually a totally doable program. The only thing is you've committed then however much time it takes to graduate to something that doesn't lead to licensure or anything like that. So you'd have to go either for another program if you wanted to be a clinical practitioner. Yes?
Is there any way to get licensed without, like, if you were to get a degree in this and then you're like, oh wait, now I want to be a clinician, like, is there any way to then get licensure? Or if you move states and you're licensed in one state, is there any way to like get relicensed, or is it just through?
So if you were to get this master's degree, no. As of now, there's no way that you could then, without enrolling in another program, there's no way that you'd be a clinical practitioner, like a therapist, an LPC, or even an associate counselor. No way that you could, because it has 0 internship hours. Meaning you have to enroll in another program that does and probably get a second master's degree, which is the least desirable option to go again for something, right? Now, if you did a master's in clinical mental health counseling that leads to licensure, you spent 3 years doing that, you did the internship hours, and then you decided this isn't for me, or I want to move states, and they say, well, this doesn't work in this state, your degree doesn't work in our state. Sometimes they'll say, well, you can take a few classes here and there at this university that is accredited, that leads to licensure, and they'll let you take a few classes through them to meet the minimum criteria for their state. Or sometimes they have special laws where you fill out a form that says, this is my licensure in Arizona, and I'm trying to transfer it to this state, and then you usually have to take their exam. Every state has their own exam too, and all these different standards. So yeah, it's pretty convoluted actually, and kind of frustrating for students when they don't kind of look into that, but this is your heads up call. Look into that before you graduate. Because what's really cool about right now is you have professors and people who have literally gone through that process that you can ask verbally. You can walk up to them during class and say, hey, I was looking at this, can you advise me on this? And they will, right? That's kind of their job, right? So this is the time to do that. It's harder in graduate school when everybody's super busy, you're super busy. It's easier now to have elective space when you live on campus, all that stuff. Super, super helpful to get those answered. Any other questions come up while we were talking a little bit about this and not leading the licensure, things like that? Okay, one of the questions I always get is what is the difference between clinical mental health counseling and a Christian counseling degree? Well, there's the difference. On the left here, so on the right side, on the left here, this is the clinical mental health counseling degree. And don't look at just the length of the list. It's dependent on the length, on how long the names of the classes are. But for that clinical mental health counseling degree, you're completing 21 classes. That includes your internship and your practicum, which is always hands-on. Practicum doesn't have to necessarily be through a third-party company, whereas an internship does. And so you're getting your hands-on experience. The Christian counseling one, I do know that leads to licensure in the state of Arizona for an LPC, and so it's less classes. I'm not actually positive on the LPC. We can look at the website though once we get past the slides here. But it's 17 classes, and then this is a Master of Science in Clinical Mental Health Counseling with a Christian counseling emphasis, and look at how many more classes that is compared. But this is probably the most optimal. If you want to be a Christian counselor specific, I would say this is the most optimal course and program, because it would basically give you every piece of training you would ever need to practice in the state, plus it would give you extra curriculum specific to Christian counseling. Whereas if you go for that MS in Christian counseling, it's going to be applicable to less and less states because it's less hours, less classes, and it's just less likely to apply to different states. And the MS in clinical mental health counseling is going to be your best all-rounder for everything. It applies to many states, not just Arizona. I know California, in some cases it has even, so that's really cool. So always do your homework though, before you commit to a program. But really the only difference is that you're taking different classes. Some of your curriculums are just different. Another common question asks, how do you balance a religious-based worldview, such as the Christian worldview? It doesn't have to be the Christian worldview, by the way. That's not the only religion out there. While functioning within a relatively non-religious oriented science-based field? The answer is whatever works for you. If you are a clinician and you're not a Christian counselor, that can be difficult to practice your religion and keep that completely separate from your job if that's what you have to do. And I will say, because you're graduating from a program, a Christian program, whether you're a Christian or not, or you follow that religion or not, which is totally fine, the problem is when you sit down for an interview and they see GCU and if they know that it's a Christian school, the first question they're going to ask you is, okay, someone who does not believe in Christianity, an atheist, sits down in your office and says, I need help. How would you approach this? And your answer can't be, well, I pull out my Bible and I show them the scripture. Like that cannot be your answer. Okay, well, you're not hired then. Because that's not how this works in psychology. We aren't telling people what to do, we're guiding them, right? We're usually meeting them at some point. We're listening to them first and then providing advice, not starting by saying, this is my beliefs and I think you should believe them too. Like, no, that's not how counseling or psychology or therapy works. So keep that in mind. Now, if you're applying for, like to be at a church and a counselor at a church, that's probably gonna be a different story, right? So just know where you're applying and understand that if they do see that you went to a Christian school, they're probably gonna ask about how you balance your Christian worldview, if you're a Christian, and they have a full right to ask that to you, right? Because you need to be safe with their patients, basically. And so they're gonna wanna know pretty quickly how well you can balance this, and you need to be prepared to kind of answer that. They might not ask, but I found that probably half or more of my students who I've written letters of recommendation for, who come to me and say, yeah, when I sat down in that interview, they totally asked about the Christian worldview, and they were like challenging me, like, am I gonna just throw Bible verses at atheists who sit in their office who are paying patients for the thing? And it's like they didn't want that, and so I had to be prepared to answer that. And that can rock your world if Christianity is the only thing you've been surrounded by your whole life. Like, that can be a totally different culture shock for you, genuinely. So just be ready for that. They're rightfully going to challenge you because they want to make sure you're going to be safe with their patients, with their clients. Okay, so moving on to GCU doctorates. Same thing, no lectures, DQs. responses, assignments due on Wednesdays. The only difference is you do a research residency, usually once a year, where you go in for 5 days for one business week and you present your research, and then you're told whether you can move forward with it or not. And it's really stressful. It's a really like strenuous program. So like for my first residency a few years ago, we went to the Crown Plaza in Chandler, which is their like hotel resort thing there. They rented out all the convention halls there, and they had all the students fly in and go to their residency, whoever was at that point in their program. And basically for the week you stay in a hotel room. Even though I lived here, I didn't want to drive an hour every morning because it was provided as part of the cost for the class anyways. And so you go in your hotel room, you wake up at usually 5 or 6, you go and you get breakfast, you start classes at 7 or 8 a.m., and then you're working with your faculty, you're working with other candidates on your research, you're working together, and then you go to sleep, you're done by 6 p.m., you get dinner, and then you go to your hotel room and you work until like midnight, and then you go to bed, you wake up, same time, all that stuff, and then you go until Friday when everybody presents their research in front of the other students and in front of the faculty. And at the end, the faculty say, nice job, you get to move forward, or sorry, you need to go back to the drawing board, try again. And that means you wait another cycle and you try again. So that's pretty stressful, honestly. But what's really cool about it is that you get to hear feedback directly from your faculty, you get to interact with other peers, and 90% of the people have a great time and like get a lot done and usually get their stuff approved to move forward. You just gotta follow the guidelines of your instructors. If you do the on-ground modality, it's the same thing, except you don't have the DQs, you do the one class per week thing, but you still have your residencies. It's the same residencies as the online students. And all doctorate degrees at GCU require the publication of a dissertation. I will say all PsyD programs that are APA accredited require the publication of a dissertation, and it has to be research-based. Like it's not just writing about whatever, like it's totally a dissertation, totally a study that you're conducting, even with a PsyD. So you can't get around that for all those people who do want to go for a PsyD. When you apply to a doctorate program, at GCU you need to have a master's degree at minimum. We're one of the few programs that requires a master's degree before you apply for a doctorate. But most programs you can just apply right out of undergrad. I don't know if anybody knew that, but you can apply for a doctorate straight out of undergrad. The only problem is you go up against people with a master's degree, right? So they usually prefer the ones who have proven they can start and finish a graduate program, especially if they wrote a thesis, and it's like, okay, they're probably gonna go for them. But if you have super good GPA, you've done a lot of good stuff with internships and employment opportunities, things like that, it can totally lead to getting in out of undergrad. I've had a student where I wrote letters of recommendation for them and they got into a PhD program out of undergrad. It's possible. And it wasn't just because they had, it wasn't just because they had a perfect GPA, they had a slightly under, 4.0 GPA, it's possible. I would say that I wouldn't write the letter of recommendation for them though if they hadn't applied to at least 2 master's programs on top of that, just because I've had them come to me and say, yep, I'm gonna only apply to 4 doctorates and I'm gonna totally get into one of them. And I'm like, well, I'm not writing you a letter of recommendation unless you apply to 1 master's. I think you should always have that one, because then you have to wait a whole nother cycle to apply again for grad programs, and I don't think that's right. I'd rather you get something for sure and have more options than less options, even if it takes a little more effort in that moment. Letter of recommendations are often required. You should ask your instructors typically. We have a slide where I ask you who you should ask and how you should ask. A letter of intent is usually necessary. At GCU, we have a PhD, educational doctorate or EDD, DNP, Doctor of Nurse Practice, and a DBA, Doctor of Business. The difference is the curriculum classes, but no matter what, they have a dissertation that needs to be published by the end. The average size of the dissertation at GCU is 200 to 250 pages and 150 or more sources. You have to have 75% of those sources from within the last 5 years. So it's a pretty competitive program, actually. Even though it's online and most people get accepted, it's definitely a good amount of work that you have to do. I'm probably at 165 pages right now of my manuscript, and I still have quite a bit to go. Let's see. Yeah, all doctorates conduct the same research. And a doctor of philosophy doesn't require philosophical classes or a philosophical publication. I had a student ask me that, saying, oh, well, isn't your dissertation, because a doctor of philosophy PhD doesn't have philosophy in it? It's like, no, that's not exactly how it works. That's just the title of the degree. PsyDs are similar. It's usually pretty much the same. I would say a PhD is slightly more, very, very slightly more weighted than a PsyD. in terms of getting jobs and things like that, just barely though. You could do either comfortably. For the PhD in psychology at GCU, you can do cognition and instruction, which is the one I'm doing. IO psychology, integrating technology, learning in psychology, and performance psychology. Those are all the subfields that you can emphasize in. It just means taking classes that are specific to that field. Nothing overly crazy. Again, it's a lot of work, but it's doable work. People do it all the time. People do it every day. They complete their work. It's not out of bounds for you guys, I guarantee it. Doctorates at GCU and at most universities they have to pick between quantitative or qualitative. For my psych majors, which is almost everybody, you take a research methods class that is quantitative, it's numerically based. However, when you get to a doctorate, you have to pick quantitative or qualitative. Quantitative is usually going to be like an experiment. It could be an observational, like correlation study, where you get 2 tables of data and then you run math on that data, right? That's typically what quantitative means. Qualitative doesn't mean that you don't use numbers. It just means that it's usually literature based. So I'm doing a qualitative methodology where I interview a smaller pool of a sample of like 15 people. I interview them for an hour, and then I do coding on the actual responses that they give me, and I try to identify themes among the responses of the 10 to 15 people. And that's what a qualitative study is. It takes a lot longer to do qualitative, I will say, but you don't have to work as much with numerical data. But the quantitative goes faster, and we have programs that do the data and the math for you, so you don't have to do it by hand. You do it using a computer program. So just make sure that you do a little bit of research before you go into a doctorate if you are considering it. Make sure you understand the difference, because they're usually going to make you pick early on, and sometimes when you don't know what the difference is, you kind of pick one that isn't right for you really early, and so it's best to just kind of do your research on that. Okay, so who do you ask for a letter of recommendation from? I would say a professor. That would probably be a good one. Make sure they have a terminal degree, meaning they have a doctorate, they have their final degree, no more degrees left to get kind of person. A lot of people ask people with a master's degree, including me, and I usually say, well, have you tried everyone else already first? And if they say yes, then I'll write a letter of recommendation for them, because you do want someone with a PhD. You want someone with a doctorate. And that could be a professor, that could be someone who hired you, whatever it is, but definitely make sure they have a PhD. If they're in academia, it's actually a pretty good look for a letter of recommendation to come from a professor, not bad. And then how do you get the most genuine letter of recommendation? You don't say, hey, Professor Johnson, can you write me a letter of recommendation? That's not how your email should be written out. Your email or your in-person conversation should be, can we meet through Zoom or in person and talk about what my academic goals are? And then if we determine that it aligns with you, would you be willing to write a letter of recommendation for me? And so the way you approach it is, I want to meet you, professor, and I want to tell you about what my goals are as a student for graduate school. And then when they come, converse with you, then, hopefully they say, yeah, I support your goals here. And they usually give you good advice too, because they walked in those shoes too, right? And that's how you get a really genuine letter of recommendation, because now they know everything about you and they can write it very personally. So when you have your letter of intent at the top, and then underneath it is a letter of recommendation from a professor, and it sounds very much like your letter of intent because you talk about similar things, that's the student they like to accept, especially in the competitive programs. So that's how you get a genuine letter of recommendation. How do you request one? Send an email, and do it 3 months before it's due. It's probably 3 months, 2 months, or 1 month at minimum, I would say. Try to keep it within that time frame. And do you need an internship to get into graduate school? Depends on which one. These are just common questions. Depends on which one you go for. Most of them, and most people will say yes. I will say it depends, because GCU, no, not really. You don't need an internship to get in. You'll probably get in, especially if you're a GCU graduate. Other schools, though, you should probably do your research, look at the forums for those classes, like a Reddit forum even, and that's actually a really good way to get a good snapshot of what that graduate school is looking for. Genuinely, go to the ASU Reddit forum, and you'll find some people ask, like, how do you get into the Masters of Psychology or doctorate or whatever, and they'll tell you kind of those details. It's actually helpful. So do your research as to whether they say you should get an internship or not, and things like that. In most cases, you can probably get away without it. However, if you have the opportunity to get an internship, absolutely jump on it, right? Don't pass that up, because most students can't get their hands on an internship. As it turns out, it's actually pretty tricky. So, any questions about any of that? Okay. Okay, last few things about health psychology. Thanks for being patient with me, I appreciate this. So no, you will notice, okay, on the right there, it's the approved programs. That's just a snapshot of the list of approved programs from the Arizona Board of Behavioral Health Examiners. You'll notice that GCU, Master of Science in Professional Counseling, leads to licensure for an LPC. Master of Science in Christian Counseling, LAC and LPC. So you would just go to the website and you can find all that stuff. And all the other GCU programs are lower on that list, but they're on there. And so that's usually what it'll look like for a state. You can look that up for any state and it'll tell you what programs lead to licensure. So if you're considering a master's, absolutely check that list if you want it to be leading to licensure. And then just a little bit about health psychology. So the class that I teach, it was created in the late 70s. Behavioral medicine was in the early 70s. And basically we study health behaviors, which is any activity that people perform to maintain or improve their health. So if you haven't taken health psychology yet, you'll learn all about what a health behavior is and how it works. And we split that up into risk factors and protective factors. So basically we study what behaviors make people healthier and what behaviors make people unhealthy, right? And we try to figure out how to promote behaviors, things like that. So from a public health level and then also on an individual health level. So one of the concepts that we usually teach in health psychology is like a physician will prescribe medicine for like high blood pressure or high cholesterol. A health psychologist will study what makes you likely to actually take that medicine at the end of the day, because it turns out only half of people who get prescribed medicine take their medicine as prescribed. And so that's what health psychology is. It's fascinating, actually, very fascinating work. And my whole master's degree and doctorate is all about it, and it's a lot of fun. So you can do clinical work, public health, higher education, university admin, and organizational health when you go into a field of health psychology. In my pathway is I worked as a student worker, worked as a TA, now I work as an instructor, and that's how I got it. No internships, by the way. That's how it worked for me. Even though I am research track, even though I do have experience in that research field, I didn't start in undergrad with an internship. It just worked out for me that I went into that higher education and then moved into research a little bit more. And your path can be anything that works for you, honestly. So yeah, that's everything for me. Thanks for being patient. That was a lot of talking. Do you guys have any questions about any of this, or any thoughts on graduate school, or something I didn't address about it? Yes, start with you.
So as far as like accreditation,
Yeah.
what's the difference between like APA accredited?
Yeah. I didn't mention that. That's a great question.
And state accreditation.
So, yeah, you'll get really frustrated when I say this. So, a lot of people don't know this, but APA, so every state, whether it's a psychologist or a counselor, therapist, dentist, teacher, nurse, they get to determine the laws in their state, period, as of now. And so if you get an APA, so APA accreditation only counts for doctorates. So many students on like a Reddit forum, for instance, will be like, oh, don't go to GCU, they're not APA accredited. It doesn't influence you at all to not be APA accredited at the undergraduate or the master's level. Doesn't influence you at all. It only applies to doctorates. APA accreditation only applies to doctorates, and it's federal accreditation. So that means when you get a PhD or a PsyD that's APA accredited, you graduate, you do your practicum hours, your internship hours, and you publish your dissertation, which is the minimum criteria for a program to be APA accredited. Then you get to take a federal exam to be called a psychologist. You can't be called a psychologist without an APA accredited PhD and without passing that exam. And then if you want to call yourself a psychologist in the state of Arizona, you go to the Arizona Psychologist Board and you take their exam. And then you prove that sometimes they accept the APA federal one and sometimes they don't. Because sometimes they have higher criteria. And then there you go, now you're a psychologist in the state of Arizona and the American Psychological Association. And that means I can't ever call myself a psychologist. I'm not, I'm a health psychology professional, but not a psychologist because my PhD is not APA accredited, and because I didn't sit for any of those exams, I'm not even eligible to sit for either of those exams. So that's what APA accreditation means. That's why a lot of people go for their master's in clinical mental health counseling, because you're not called a psychologist, you're a counselor, you're a therapist, right? And you go for clinical mental health counseling. It's a little bit longer than normal masters or a research-based masters, but then you get to practice in your state as a counselor, and that's a good way to go about it. Yeah, did you have a second one? You can go ahead. Sorry.
So I want to be like a professor, but I also want to practice like psychotherapy and like counseling and stuff. But I want to work in like prisons or communities and stuff like that.
Okay.
And so, what are like the benefits of me getting an APA accredited degree, or like just going for
Yeah.
a
Doctorate.
master's?
Or master. I would say, so it depends on what you want to teach. If you want to teach psychology classes, you can do that with a master's. Usually they like to see that you're enrolled in a PhD and you're in progress, like me kind of thing, where I'm in progress. It's not the only criteria. There are many instructors who are adjunct, meaning part-time, contract pay, who only have masters, and that's totally possible. And so if you wanted to do that, you could get your master's in clinical mental health counseling, work in the Arizona, you could do it in the prison system or whatever you want to do, correctional facilities, whatever. And then you could also teach classes, like that could be your option. If you wanted to be full-time, you would need a doctorate though, and I would say you could be a forensic or a correctional psychologist, which is where you might work more in the court systems instead of in the prison system or the jail system kind of thing. That's different than working in court, which is usually psychologists. So it kind of depends on what you want to go for. Technically speaking, nothing stops you from doing a master's in clinical mental health counseling, getting your feet wet, working as a counselor, and then working your way to teaching and getting more involved in correctional facilities, things like that. The only problem is it takes a little longer than, if you decide, yeah, I want a doctorate, then now you're already, 4 years deep undergrad, maybe 3, maybe 2, and then, probably another 3 for a master's. And so that's a lot of school. And it's hard to then say, okay, another 4 for a doctorate. Like that's a lot, right? So I will say you should take a PCN class. Take PCN, which is professional counseling, if you haven't already. PCN 107 is a good one to start with. And your teacher will be a therapist, meaning they have their LPC, and they might even be a correctional therapist. We have a lot of correctional therapists who are professors in that program, and you can pick their brain and also learn about the therapeutic methods like psychodynamic theory. So PCN 107, counseling theories, that's what I would start with. Okay, yeah, you were holding your hand for a while. What's the question?
So I work with kids.
Yes.
If I get my bachelor's in forensics and then get my master's more for specific with children, because I've been told I should switch my bachelor's to something with kids, but I don't want to study kid psychology right now. So forensics sounds more interesting.
You can stick with forensic and you can get into a master's of psychology. You can get into a master's of clinical mental health counseling, no problem. Yeah.
So studying forensics won't be a barrier later on.
It won't close doors for master's degree eligibility. The programs are still competitive outside of GCU, I would say. So you still would have to build your profile to get in. But no, forensic psychology should not hurt you in undergrad. In my experience, it won't hurt you, it won't harm that. It won't close doors necessarily. If you were general psych, or if you had an emphasis that focused on childhood psychology, I think that would probably open a few extra doors, but I don't think it's particularly hindering you to stick with the forensic psychology. I personally think that's a good way to go. You get a lot of options. So, does that answer your question generally? Yeah, okay. You, back.
2 things. One, how long usually are like your doctoral program specifically, how long is it?
A doctorate is usually 4 years.
Okay.
The average at GCU is 5.2.
5.2?
Yes, most other schools 6 or 7.
Actually,
That's fine. So second.
have you, I was trying to, look into other schools that have combined master's and doctoral
Okay.
programs. Do you know, a lot about that, the success rates?
I know a lot about that, yeah. So typically, there aren't many of those. And the reason is, so in a classical doctorate, you don't actually pay for the doctorate. Typically, you apply, and it's kind of like a job interview. That's why it's super competitive. They basically say, okay, sign this contract, 4 years to get your doctorate, and then maybe 6 years committed with us as an instructor or as a therapist for our clinic. And then you walk away after those 6 years not paying a dime, because they give you a grant, and that's what you study. And now there's only 10 students out of 10,000 applicants, of course, in these programs. But they give you a grant, that's what pays for your school. They give you a stipend, that's what pays for your food and your housing. And then you work for a couple more years, and then you walk away with no debt. That's a classic PhD, and if you look online, people will say that's the only PhDs you should be looking for. I don't fully agree. I think it's okay to pay for your doctorate. But classically, you don't pay for your doctorate. You get a grant. You're basically going into an agreement saying, I'm going to work for you, university, and in exchange, I'm going to get my doctorate. And so what happens is, if people have a severe life emergency and they're 2 years into the program and they need to drop out, sometimes the school will award a master's degree. And so when they finish that program, students say, I have my master's and doctorate, when really it's only a doctorate program. That's where that originated from, and now some programs do offer where you get both in one, but it's not much different from just going to a one where you get your doctorate. And sometimes it's longer, sometimes it's a shorter, it really depends on the school. I wouldn't call that, I wouldn't make that plan one if I were you. I wouldn't say I want a master's and doctorate in one. That probably wouldn't be my primary plan.
Okay.
Third question?
Third question was just, I don't know how objective you can give this response.
Okay.
But I know GCU kind of had a lot of backlash, especially last year, and in the doctoral
Yeah.
program specifically.
Yes.
And I had a professor that was also enrolled in one of the doctoral programs for psych, and he was saying that that's all kind of crap.
Yeah.
And that the backlash isn't based on anything, but I just know that they got their accredited questioned, and there's just been a lot of stuff with people that don't know GCU around the world. But I know that you also have your degree and you teach here.
Yes.
If you would recommend to students, if I wanted to do my master's or get my doctorate, if it would be smarter in the long run, just because of GCU's current reputation, if I were to go to
That's a good question. Yeah, no, that's a fantastic question. One that I'm quite familiar with, as it turns out. So yeah, I will say that I don't speak on behalf of the Doctoral Studies College, by the way, CDS. I do not speak on behalf of them, to be clear. However, the fine is based on zero real evidence. We have students who complain because we tell them, yeah, if you spend 4 years, you can graduate with your doctorate, which we have students who have graduated in 3 years, actually, where they did all their curriculum classes, they got their dissertation done. Every doctorate program that's AP accredited is gonna have a dissertation, and it's not I finished the classes and then I get a diploma in exchange for those classes. It's I finished those classes, and then I go through AQR, IRB, all these different review cycles, which is all at GCU, and then I publish my dissertation, which could take 2 years, it could take 3 years, it could take, we've had people in the program for longer, right? It just happens. There's people at ASU who've been in their program for 12 years because they couldn't get published. It just happens. That's how a doctorate works. Now, one of the complaints was that people weren't graduating in the advertised time of 4 years, and so they said, this is crap, I'm suing the school. So if I told you it took you 4 years to get a bachelor's degree and then you failed the class and it took you 5 years, would you sue me because you failed the class? That's kind of what ends up happening, is you don't meet the minimum milestone for your dissertation, so you retake the class, and then your graduation is delayed because you're not publishing at the specified time. And that is genuinely my take on that situation. The actual application page said, you only graduate when you finish your dissertation. This could take longer than projected. And it says it in red writing. And the Department of Education came to the conclusion that doctorate students, our highest level of students in the world, can't read a big bright red message before they apply saying, by the way, if you fail a class, you don't graduate in this time. They didn't apparently read that, and so now it's our fault for them not reading that. So that's my take. It's pretty, biased, of course, because every degree is from GCU. Like my life is GCU. My wedding ring has an antelope in it. I'm not kidding. So take it with a grain of salt, right? I met my wife on campus, so on the same level course actually. So yes, I am biased. I don't think you should worry about it though. My mom went to a school, for instance, and I don't think it's going to happen. I don't think this will ever happen, but students have come to me saying, do you think GCU will go under? I don't think that's going to happen, personally. My mom's college, though, did go under recently in Wisconsin. A lot of schools there have really low enrollment. Like right now, schools in the country are low in enrollment. I will say that we've reported higher numbers. We're one of the few schools that do, because we offer pretty good education. We provide more nurses in Arizona than any school right now, teachers, things like that, like things that are important for our community. And I truly do believe in that. And I'm not someone who's like a super I'm this big Christian, I'm gonna be in your face, I'm a GCU Christian guy, that's not who I am. I just have gotten all my education here. And my life was built here from nothing. I came here in 2018 knowing knew nobody, came here with no friends, nothing, and I turned myself into now an instructor and getting my doctorate and all these things from nothing. And I attribute a lot of that to having a good program that set me up for those things. And so my answer to you is that I wouldn't worry about it necessarily. If you have indication to worry about it, value your own education over a school, absolutely. find a program that you need to go to. Find a program that's right for you, even if it's not GCU. That's 100% what you should do. But in my mom's case, her school went under because they were higher commission accredited. It's still a valid degree. So if you graduate from a school and then they go under after, being a higher learning commission accredited degree is basically like an insurance company, where they say, yeah, the school is under, but you can call us and we'll still prove that you graduated while they were functioning and accredited. And then you can get any job, any graduate program, whatever. Like that's, so my mom had to do that. She had to call and say, hey, the school went under. And they said, okay, well, here's your transcripts. We still have them. We're gonna hold them until forever, basically. That's our jobs, right? And sometimes they transfer to another school. And so we have those insurances in place. That's why you always get a degree from a higher learning commission school, because they're insured, basically, even if they go under. So it's your choice to make, but like whatever school is right for you is what you should do. And I'd support that 100%, even being super GCU. Any other questions? Yes? One, I'll get to you in a second, yes.
I was gonna ask, is a master's degree something that you can do while working full-time, or
I
is
did.
it like an undergraduate where you're in school, like that's your life?
Well, it depends on the program. So my students at Carroll, it's hard to work full-time, especially in the beginning of the program, because it's a brick and mortar school, they're in person, they have an instructor in a classroom. And so for them, yeah, that's tough, honestly, because their day is filled with classes. They usually do Tuesday, Thursdays, and then Monday, Wednesday, Friday, they have opportunities to work part-time. Now that they're about to graduate, they're not working full-time and it's a little more manageable. GCU, I was working as a TA, I was working full-time, and I was doing the master's program. And even now for the doctorate, I work full-time. I teach at GCU, I teach at Carroll University, and I'm doing the doctorate. So it's possible, it's a lot of work, you know, every moment of every day is working, you know, that's for sure. And I can't wait for that to be done, but it's totally doable. And we design our programs at GCU to be accommodating for a full-time schedule. That's why due dates are on Wednesdays, so that you can spend time relaxing on your Sunday kind of thing. Like that's why we've designed these systems, and it is doable. I know I say things are hard, it's doable. 100%. I have students who say, my biggest worry is I'm not gonna be good enough for graduate school. And I say that's probably should be the least of your concerns. Can you commit to like submitting an assignment on Wednesday at midnight, once every couple weeks? And if you can say yes to that, you can get yourself through an educational program, even working full-time. And I will say one last thing to answer your question. The definition of education is to teach you something you didn't already know. If we were to strip it down to the very basics, to teach you something you didn't already know. So many students say, oh, I don't know these things. Like, no, you shouldn't. That's why you're getting the degree, right? That's the point of the education, is to take you from a place of not knowing something to a place of knowing something, having those skills. So be confident in the fact that not knowing something is not an excuse to like not pursue programs or education. You're supposed to not know something. You're only supposed to know it after you've graduated. That's kind of the point, is to learn something, to walk away with more than you came in. Did you have a question? Do you have your hand or no? In the back there? No? Okay, yes.
I wanted to ask, what is the difference between getting an internship and job shadowing, like a position that you want?
So an internship is usually where you're doing hands-on work, where you're actually helping out, like for a researcher, you're actually helping them out by collecting data, running data analysis, whereas a shadowing program is you're watching someone do all that work, right? So if you were to follow around a counselor all day, you'd be watching them do the counseling. If you were an intern for a counselor's office, you would probably be doing the counseling. That's why you have to have a master's degree to get an internship in a counseling office. Because if you're actively in your master's degree, that means you're an associate counselor. You can treat patients. It's just you have to do it under the direct supervision of an LPC, a full professional counselor. So that's an internship, whereas shadowing would be, I'm an undergrad student, I'm a high school student, and I'm gonna follow you and just watch what you do and learn from that,
Okay.
which is allowed, it's just not hands-on. Any other questions? Yes?
Yeah, just a really quick one. What are your recommendations, or like how do you feel about taking gap years in between like your bachelor's and going to grad school for a doctoral degree or for a master's degree?
I'd rather you take a gap year and make sure you're ready for something than to jump in, not be ready for something, and then drop out.
Sure.
Because you're wasting time and money then.
Yeah, and then second question, what's the difference between like rolling admissions versus like a hard deadline?
So like for graduate schools where they have a rolling admission, you mean?
Yeah,
Okay.
so like a lot will say like rolling, apply between these months,
Yeah.
and then hard deadline by.
That's a great question. So most graduate programs, master's or doctorate, the deadline is usually November 1st, December 1st, January 1st, and January 15th. Those are the most common deadlines. Some schools have all of them all at once, and that's a rolling deadline. And that basically means we do reviews in rounds. right? Everybody, some people apply December 1st, some people apply, January 1st, and then the very late applications go January 15th to start for that next fall. And so rolling deadlines for those applications just means that you can apply in that span of time. I recommend doing it as early as possible. The first applicants are the ones who are gonna get the most attention and who are gonna probably have the highest chance of getting in. If you're submitting your application at the very end of that deadline, it's probably gonna be a little less powerful because they've looked at 1 million applications by that point. They're probably gonna be sick of looking at applications. I don't think you want them to be in that attitude when they read your application. You want them to be happy, like, yeah, we're just about to start looking at applications, this is fun, and then after a month, they're like, this sucks, I don't wanna do this anymore. You don't want them to look at your resume at that point, right? You don't want them looking, so, yes.
So I want to get my degree in forensic psychology,
Nice.
and I eventually want to work either with the FBI or Homeland Security.
Okay.
I specifically want to work on the trafficking side
Mhm.
and with victims.
Mhm.
Do you recommend getting my master's and then going straight into the training for those law enforcement divisions, or do you recommend getting a doctorate then doing that? Like, which one do you think would be more useful long term?
Depends on how long you can handle education and how long you can hold out so that you can get a higher salary. So typically when you go into the FBI, CIA, any governmental agency, the higher your degree is, kind of like military, the higher your degree is going into those things, the more pay you're eligible for. So if you have a doctorate in psychology and then you go to FBI for psychology, you get pretty much bumped right into the $100,000 plus range of salary, which is pretty rare. Most people who go that long in education aren't doing it for the FBI. They're doing it for being an instructor, being a researcher, being whatever kind of thing. So that's kind of rare. So it depends on what works for you. If you want to go out of undergrad and say, I want to go into this, and then potentially get your training as part of that, sometimes they will pay for it. I obviously am not the government, so I can't tell you if they'll pay for it, but sometimes they have programs like that. Or maybe you say, I want to get the master's, like I have the funds and the capacity right now to get my master's, and then be bumped into a higher tier when I go into a governmental position. And then, yeah, you're basically holding off, you're spending a little more money to invest in that to pay out a little later, which is, if you can handle it, or if that's right for you, then I'd recommend that, but you can do it either way. Totally possible. Yes?
If you're taking a gap year, how do you go about getting professors' recommendations? You just tell them that you're applying next year?
Yeah, and that's the biggest challenge with taking a gap year. Although I think it's great, I'd rather you take a gap year if you need it, right, than to go straight in. I will say that the problem is then you become less recognizable to your instructors when you do email. And so the best way to email is to say, hi, my name is this, I was in your class this semester, this year, and I'd like to meet with you. That's one of the reasons why you say I'd like to meet with you, because then they can reacquaint themselves with you, understand what your goals are, and so that's how I would do it. You can tell your instructor saying I'm taking a gap year, but expect an email from me at some point, and if I were you then, stick to the full-time faculty. Adjuncts can leave. I applied out of undergrad right away for a master's program, and I had an adjunct who had taught in that last semester that I was graduating in, and by the time I emailed them, literally a month after the semester, they were already gone at another university and I couldn't find their email anywhere, kind of thing. And the email I was emailing wasn't working anymore because they weren't at GCU anymore. So if I were you, because of that gap year, you should probably stick to the full-timers because they're more likely to stick around for a longer period of time. So if you can build relationships with them, I'd say that's a good bet to kind of make sure that you've got those letters of rec or contacts for later, if that makes sense. Any other questions, or you feeling okay? All right, I guess that's it then. Thank you guys, I appreciate everything.
Thank you.
Thanks for your attention.